Case monitoring, progress evaluation, and troubleshooting. Starting with the course outline, we will discuss how to monitor your Eon case and how to evaluate the patient's progress. Then we will move to troubleshooting, where we'll discuss the most common problems usually encountered during the patient's treatment journey. Let's start with case monitoring. In each patient's visit to the clinic, monitor the case by comprehensively checking the fit of the current aligners, the shape, and the condition of the attachments. Check the amount and the location of IPR performed. Make sure it is correct and as guided by the IPR sheet sent with the patient's treatment kit. And finally, look at the patient's teeth one by one, from an occlusal view, and compare their current position to their position in the treatment setup video. Ideally, if the patient has been compliant with wearing his aligners and the treatment is going as planned, there shouldn't be any discrepancy between the two. Here is an example of how to compare patient's progress. An occlusal view of the treatment setup is compared to the patient's teeth alignment at a certain step. In the first case, we notice the similarity of alignment, which means the patient is on track. The second photo clearly shows the difference in position of the central incisor, which indicates poor tracking. Now, after the checkup has been done, you can evaluate the tracking. The term tracking is used for evaluating treatment progress, which refers to how well the aligners fit. Tracking can be perfect, good, or bad. Perfect tracking means that the aligners are fitting the teeth 100% and the treatment is going as expected. Good tracking means that the aligners are not fitting 100%, but the teeth movements are going well and as planned. There's no major problem, and in this case, you can proceed normally. Bad tracking means the aligners are slipping away, movements are slowed, or even have stopped progressing. In this case, troubleshooting is necessary to point out the cause and carry on the necessary adjustments. Here, we share with you a diagram that shows some of the main issues that might lead to bad tracking, including, but not limited to, patient's compliance, tight contacts, attachments, challenging movements, tissue impingement, occlusal discrepancies, external factors, residual spaces, and black triangles. We will discuss each issue separately. Let's start with the patient's compliance issues. You can tell that your patient is not being compliant if he or she repeatedly misses their appointments or shows up not wearing their aligners. Also, if you notice that they have difficulty in putting on the aligners or taking them out, this means that they are not used to wearing them. Really clean aligners are not a very good sign as well. In this case, we need to motivate our patients to wear the aligners as instructed. You can also practice wearing and taking out the aligners together and give them tips, like rinsing the mouth with warm water before taking the aligners out to make it easier. If you find that the current aligners are not ideally fitting, ask the patient to wear them for an extended time and use chewies to improve the fit. If you notice loss of tracking and the aligners are not fitting, then ask the patient to go a few steps back and wear the most fitting aligners for a period of time, and then continue normally. Tight contacts can affect tracking too. This will lead to problems like aligners malfitting, rocking anterior-posteriorly, no teeth movements, and loss of treatment progress. IPR is sometimes necessary to provide space to move and align teeth. You can check for tight contacts using a dental floss. If the floss doesn't pass at areas where IPR is planned, make sure to reperform it correctly and with accurate measurements. If the floss doesn't pass at areas where IPR is not planned, then all you have to do is free the tight contacts with fine IPR strips. And lastly, if the floss passes freely between the contact areas, then look for other reasons why tracking is lost. Next, let's see how problems in attachments can lead to loss of tracking. Not having attachments where needed could lead to loss of tracking, especially when difficult movements are planned. So, in this case, a mid-course adjustment is needed that includes using the correct attachments for these difficult movements. If you notice that the aligners are not fitting around a specific attachment, you have the following options. You can either ask the patient to go a few steps back and wear the most fitting aligners for a period of time, and then continue normally and use chewies for better fit. The second option is to remove the troubling attachment and proceed with the treatment while keeping an eye on the progress and also assessing the need for refinements at the end of the treatment. Replacing the troubling attachment is also an option. The current aligner is going to be the template with which you're going to add the attachment. If neither of the previous solutions is applicable, then take new impressions or scans and ask for a mid-course adjustment. If you notice that an attachment was debonded or fractured, the decision on what to do will depend on if it's an active or passive attachment. If it is a passive one, then you can simply accept its absence and proceed with the treatment while monitoring the treatment progress. On the other hand, if it is an active treatment that is vital for the predictability of the movement, you can replace it using the current aligner as a template. A less likely scenario is requiring mid-course adjustment if the previous troubleshooting options were not viable. Some movements are naturally more challenging to achieve than others. Therefore, some loss of track or a lag in the aligner might be expected. Such movements may include extrusion, severe rotations, and long-span bodily movements. If a lag is seen, you can do one of the following. First, give the aligners enough time to move the teeth in the intended direction, because everyone's biological response is different than the other. Or use auxiliaries to increase the predictability of such movements if deemed helpful. One other problem that you might face is tissue impingement due to gingival enlargement in the interdental papillae, or the gum distal to the second molars, causing aligners malfitting, pain, or rocking of the aligners anteroposteriorly. You can simply ask a periodontist to reshape that part of the gingiva, or you can trim the aligners from that area. At some instances, the treatment might end up with some occlusal discrepancies. This can be due to different reasons. The presence of third molars that were not captured in the scans or impressions. This will lead to over-eruption of third molars during the treatment, as they're not covered with the aligners. To resolve this issue, we can do one of the following. If the interference was mild, we can simply do selective grinding to settle the bite. If the over-eruption of third molars caused a mild posterior open bite, we can trim the last few aligners distal to the first molar to allow the occlusion to settle. Or, if the interference is more severe, extraction of third molars may be indicated. The natural intrusive forces of the aligners might cause a posterior open bite at the end of the treatment. In most cases, this is usually mild and will naturally settle after placing retainers. Placing fixed lingual or palatal retainers will have the occlusion settle faster. Or you can trim the last few aligners distal to first molars to reverse the posterior teeth intrusion and again let the bite settle by itself. In case it was a localized posterior open bite, elastics can be used to correct it. Sometimes external factors can lead to problems in aligners fitting, thus loss of tracking. Calculus accumulation can prevent the aligners from fitting properly and also prevent the teeth from moving to their favorable position. So, it is prudent to explain to your patient the importance of the routine dental checkup visits to maintain healthy dentition and surrounding soft tissues. Second external factor is restorative dental work. It is recommended to advise your patient to delay an elective restorative or prosthetic dental work till the end of the treatment, because it will affect aligners fitting. In cases of urgency where the patient had to perform any major restorative treatment, take new impressions or scans and ask for mid-course adjustments. Finally, if a tooth gets chipped or fractured, loss of tracking might happen because the aligner won't be fully grabbing around it. In this case, mid-course adjustment might be needed as well. At the end of the treatment, you might notice that there's extra residual spaces between the teeth. This might happen if the aligners were not given enough time to fully retract teeth and close the spaces, or due to performing excess or incorrect IPR. This problem can always be fixed by asking for extra refinement aligners. The last thing we're going to discuss in our presentation today is black triangles. We might notice black triangles between the teeth at the end of the treatment. Tipping movements, triangular-shaped teeth, and short interdental papillae can be some of the reasons behind the appearance of these triangles. To avoid black triangles, plan to use attachments to ensure that bodily movement is happening. For triangular-shaped teeth, IPR can be planned to reshape the teeth and move the contacts more cervically. If you still notice these triangles at the end of treatment, refinement steps with IPR and teeth retraction can solve the problem. Thank you for watching.